Hi, this is Satya, see me at jensatya.com. In this video, I'm going to talk about the 5 different experiences I'm seeing people have with COVID-19 and a few of the topics around testing and immunity that we're finding which we weren't expecting. I hope you find this useful. In my experience of treating this virus from a homeopathic and alternative medicine perspective since February, and also being on teams of practitioners worldwide that are discussing cases, I'm seeing 5 specific categories of patients. The first group of patients that I'm seeing are people who have tested for antibodies. They've been asymptomatic and didn't even know that they were carrying the virus. And we don't know that much about this group because it's not a major focus. What we are learning is that those antibodies don't always mean what we think they mean. They don't necessarily mean immunity. And I'm going to talk about that more in testing. The second group are those who are asymptomatic. At the start, we know around about when they contracted the virus, and they don't get sick for a while. And it could be 3 weeks, it could be 6 weeks, and then they get sick. And one of the things that we are learning about this, or actually I'll restate that to one of the things we're curious about, because I'm not sure that we're fully learning what this is yet. We're curious whether or not they are contracting the virus from a secondary source of the virus, or if something is getting triggered suddenly in their immune system due to stress or another underlying illness kicking up that is causing the virus to suddenly become active for them. So we're not sure yet. The third category are those who are getting really sick and then suddenly getting better, and we can't actually say why. And we're finding in these cases, and I'm sure you've seen plenty of them on the news, where someone thought they were going to die, they say goodbye to their family members, and then the next day they're happy in bed. We don't know exactly what's going on. The fourth category are those who are getting very sick and then never actually getting better. And this is what I would call chronic COVID. And I'm going to talk about this at more length in my next video on COVID and Lyme disease, because I see many correlations in the way I've treated Lyme disease over the years. And chronic COVID is showing so many different symptoms, just like chronic Lyme disease does, that I think there's a lot of similarities there. Now, obviously, because COVID is a contagious virus and Lyme disease is bacteria-borne, they're very different in some of the medical aspects of them, and the contagion aspect obviously makes it a completely different scenario from a global pandemic perspective, and at the same time from a patient care and a patient psychological perspective, I think there's a lot of similarities around how people have to deal with something when the standard medical community doesn't know how to treat it. The fifth form of COVID situation is what I call quick clearing COVID. These are the patients that get a little bit sick, their immune system can deal with it, and they then clear it right away. Now, previously in the US, Dr. Fauci and other clinicians had said when someone clears COVID that quickly, they develop antibodies and then they're immune, at least for 3 months. That was the original thought process behind this. First of all, we should talk about what is immunity. I will get into this more in my next video on testing. And immunity is not black and white. It's not like we suddenly shut the door. And that has not been explained to the public. Immunity can be on a scale. It can be a range. Someone can have more immunity or less immunity. It doesn't mean they can't get sick again. It might mean that they don't get as sick, or it might not have any implication at all, because we may find the virus mutates so much that the original immunity to the old mutation has no effect on the new ones. So we cannot assume a quick clearing COVID case is proving immunity. And we need to wrap our head around what it does mean if someone clears it quick. So this was a little bit on the 5 different types of COVID responses I'm seeing most often. And the next video I'm going to talk about testing and what these 5 types of COVID experiences can mean for testing and for treatment. I hope it's useful. Blessings and good health.